All right, even if you aren't someone that has varicose veins or spider veins, you have at least heard of them, right? The fact is, more than half of adults over 50 are affected by them. And they're not just unsightly, they can be uncomfortable, painful even, which is why they are ready to restore your health and your confidence at Columbus Vascular Vein Aesthetics. So here to shed some light on how they do all of that is Dr. Tom Doyle. It is good to have you on with us.
It's great to be here. Thank you.
All right, I alluded to the fact, I talked about, these are pretty common things.
Yes.
I think a lot of people who struggle with this and maybe try to hide it think, I'm the only one dealing with this. I don't want people to see. But this is an issue that so many people face, correct?
Yes, really almost everyone will develop some vein issues over time because it's just wear and tear on your veins due to gravity and fluid pressure, the same way that arthritis can be wear and tear on the bone. So almost everyone will get some degree of vein issues. It's been in the public eye a little bit recently since Donald Trump was diagnosed as having venous insufficiency. So there are real complications that can come from it.
And you mentioned that one. We talk about varicose, we talk about spider. Those aren't the only two, the ones that we hear about all the time, right?
Correct. It's a whole spectrum of disease from quite medically significant all the way to cosmetic. And we try to do a very thorough approach of evaluating all the aspects of vein care so we can get to the right
place.
Yeah.
Even, I've heard of restless leg syndrome a lot. Even when I was pregnant, I had that. I didn't realize that was really a vein condition associated with that.
It definitely can be, because if you think about it physiologically, blood comes down in the arteries and has to come back through veins. And if the veins aren't working well, the blood slows down, so you lose oxygen, build up metabolites, and you'll want to move. You want to pump that blood out of there.
That was the worst, I'll tell you. And you probably have a lot of people who have dealt with issues, similar or not, and say, I ignored it for a while, or I tried to hope, that I could just get through it, and then they come and see you, right?
Absolutely. It's easy to neglect because it is slow in onset. It takes decades sometimes to manifest, and so people just think, well, that's my legs. But if you come in and get an evaluation, we can determine with an ultrasound the degree of your vein disease. And if there are significant problems, the treatments are very easy to get you where you want to be.
Okay, let's talk about a few of those then, doctor. First up, there's something called RFA.
Yes.
I'll let you explain what this one is.
Sure. RFA is called radiofrequency ablation, and it's basically insertion of a small catheter on the inside of a problematic vein. Then you numb around the vein and you run the catheter. It heats up and closes the vein with thermal energy. It's pretty sophisticated, but very easy to do. You can do a typical procedure in about 15 minutes. I've actually had the procedure done myself, so I can vouch for it as a patient. It's really not bad to go through.
Not bad to go through, and something I feel like that does make a huge difference. Like, you probably have folks that after they do that say, why did I wait this long, right?
Yes.
Yeah.
Very often people will get a lot more energy in their legs, more spring in their step, and they'll say, wow, I didn't realize my legs weren't supposed to feel that way. And they're very happy that they have gone through the treatment.
Yeah, we put up with a lot, don't we?
Absolutely.
All right. Next up, sclerotherapy. When is that the treatment procedure?
So a rough analogy is priming before you paint. We will get people coming to our practice who have had cosmetic sclerotherapy and they didn't like the results because the veins just came back. And that's probably because they didn't get to the underlying pressure underneath with the RFA or similar procedures. But once you've taken care of that and you have just the residual veins on the surface, regular sclerotherapy, where you just take a very fine needle and inject into the vein and make them shrivel up and disappear, that can have a great cosmetic result for you.
Okay, Varithena?
Varithena is a specialized form of sclerosing solution that's mixed with oxygen, so it can give more. You've probably heard of scuba divers getting the bends. If there's too much air in your system, too much nitrogen in your system, that's dangerous. But if you make the solution with oxygen, it's very safe to use throughout the whole body.
Okay, so all of those in mind, you do, like you said, have a thorough evaluation. So if somebody has something and they don't really know what it is, but they're not feeling like their legs are getting the movement, maybe getting the energy, they're feeling them kind of strange. I feel like that's a great place to start, is to say, hey, do I have an issue that I am unaware of maybe?
Exactly, and some of the common things you might pick up on if you look at your own legs are things like swelling or any bulging veins, symptoms like the restless legs, night cramps, that's a big one. If you notice cramps at night, or just fatigue, heaviness, any of those could be related to venous insufficiency and easy to diagnose and address.
To diagnose and treat, and it's good to know there are treatments that aren't anything invasive that you really have to, go through it to get them treated.
Absolutely. Yeah. What used to have to be done was a thing called a vein stripping, which was a very elaborate surgical procedure. You'd go to the hospital and you'd literally cut the veins out. But with the advent of ultrasound technology in the past 15, 20 years, it's turned what used to be a 3-day hospital stay into a 15-minute office visit.
Okay, so think of that, right, in handling these. Okay, doctor, where are you located? How do people, get a consultation and meet with you and your team?
Absolutely. We have an office in Westerville, and we have a website, and you can certainly get on board to check it out and come see us in the Westerville office. Very easy to get an appointment. This is something that typically is covered by most insurance plans. It's not something out of pocket or cosmetic in most cases. It's all insurance driven because it is medically necessary.
Yeah, absolutely, especially if you're dealing with pain. You're dealing with an uncomfortable situation. So reach out to the team there. All the information on the screen as well. Doctor, thank you.
Thank you very much. Great to be here.